Well, now that we've talked about different kinds of pathogens, now we want to talk about how your body fights pathogens. In other words, we want to talk about your immune responses. And your body has 3 lines of defense for fighting disease, and we're going to talk about the first line of defense. And your first line of defense includes your integumentary system, which is your skin, your respiratory system, and your digestive system. And we're going to talk about each of these in the upcoming slides, take each of them individually. So, with the first line of defense, the integumentary system, your skin produces oil and sweat that has chemicals in it that can kill different pathogens before they even enter your body. And the only way that pathogens can enter your body through the skin is if you have a cut. And also in one of your first lines of defense is your respiratory system. And this includes your lungs and trachea. It also includes your nose. And the lining of your respiratory system has cilia, which are microscopic hairs, like in this picture, and also mucus. And this mucus and cilia trap pathogens. And then you sneeze and cough to get rid of the pathogens. And finally, in your first line of defense, you have the digestive system. You have chemicals in your saliva, and you also have acid in your stomach. And these things kill bacteria before they have a chance to cause disease. And this would be bacteria that you have eaten that are in your food, or if you've put your fingers in your mouth and gotten germs into your mouth on your hands, then your saliva and acid in your stomach help to kill those before they can take hold. Now, that first line of defense really had very little to do with your immune system. Your immune system was not involved in that process. So now we have the second line of defense, and this is what we call the inflammatory response. Now, this is mediated by your immune system, but your immune system is not directly involved in some of these steps. Now, of course, you've got white blood cells, you've got inflammation, and you have fever. These are your second lines of defense. And so first we'll talk about the white blood cells. And your white blood cells, well, they kill pathogens. We learned that in our human body unit about the immune system. And here we see a picture of a white blood cell. And another part of the second line of defense is inflammation. And your immune system makes certain chemicals that cause an inflammatory response. And that response is that your arteries in the area enlarge, which bring blood flow to the area. And that's important because bringing more blood to the area brings more of those white blood cells that can kill the pathogen. But the side effect of that increased blood flow is redness and swelling. And we can see in this little boy, he's got an eye infection, and so the whites of his eyes are very inflamed. You can see a lot of redness. We don't necessarily see swelling in his eyes, but we do see a lot of redness. Okay, also, finally, in our second line of defense, we have fever. And white blood cells produce chemicals that tell the brain to increase the body temperature. And that has the effect of killing bacteria. A fever creates a very harsh environment for bacteria to live in. So, although a fever feels miserable and can make you feel achy and yucky, it actually is kind of a good thing because it helps to kill off those pathogens. Okay, and our third line of defense is the immune response. Finally, we're seeing our immune system in action. And our white blood cells, we have specific white blood cells that target specific pathogens. And we have T cells, and T cells help to identify specific pathogens by recognizing something called an antigen. And an antigen is a marker on the surface of the cell that is kind of an identifier. Our own cells in our body have antigens that say, hey, I'm Miss Russo's cells, I belong here. Well, this is a virus, and it has those little spikes on it, and those are antigens, and those are recognized as being foreign. So that T cell sees that virus, kind of gets a feel for those antigens and says, oh, you don't belong here. So he sends out a chemical signal that signals B cells to start producing antibodies that help to destroy the pathogen. And so these little Y-shaped things, these are antibodies that have been produced by the B cells. They attach to those antigens, and then once those two connect, it sends out a big beacon, a signal, whoop, whoop, to the other special white blood cells to come and eat up that organism and kill it. Okay, so now that we know about the different types of defenses that our body has, let's talk about how infectious disease affects your health and what we can do about it. So immunity is your body's ability to destroy pathogens before they can cause disease. And antibodies, we just talked about them, but let's remember that there's special proteins on the surface of a cell. And those antibodies of a pathogen can help your immune system destroy that pathogen. Antibodies are the proteins that your immune system make that attach to the organism, the pathogen, and help you to destroy the pathogen. Okay, we have two types of immunity. And the first type is active immunity, and the second type is passive immunity. And active immunity, it lasts forever. And one of the ways that we acquire active immunity is through vaccinations. And a vaccine is when a harmless amount of a pathogen is put into your body. It's injected into your body to help you build up a resistance to it, so that your body naturally makes antibodies to the injected organism. and then those antibodies stay with you for life. So if you ever encounter that organism again, you have antibodies that recognize that organism and alert the immune system to kill it. And in contrast, passive immunity only lasts a few months. And there's a few ways that you can acquire passive immunity. And this would be there are a few diseases where if you think you may have been infected with the disease, then there's an injection that a doctor can give you. They can give you the antibodies to help you fight the pathogen, and one of those is hepatitis. And it's different than a vaccine. This is where it's really not even giving your body a chance to make its own antibodies. The doctor's just going to give you the antibodies so that you can fight the disease. And the other way is babies. They're born with passive immunity that lasts for about 6 months. They get it while they're during pregnancy. The mother passes antibodies from her blood to the baby, and that helps protect the baby from infection from serious infections for the first 6 months. They also can also get antibodies through breastfeeding. So babies are born with passive immunity. And treatments. If you are infected with a bacteria, the treatment is antibiotics, rest, and fluids. Antibiotics can kill bacterial diseases. And viral diseases are different. Their treatment is rest and fluids, and then just treating symptoms such as fever and pain. It's important to note that antibiotics kill bacteria, but they're completely ineffective on viruses because they act on life processes of bacteria. And viruses are non-living. They don't go through these life processes, so they're completely ineffective. So if you have a virus, an antibiotic will not help you. They're only effective for bacterial diseases. All right, well, that was a long one. We made it, and congratulations. Thanks for watching.